Well, CICOA is the state's largest nonprofit focused on helping seniors age in place and people with disabilities live as independently as possible. CICOA is now enhancing its focus on another very important person in the picture, the caregiver. Business of Health reporter KYLIE VELETA has more. KYLIE.
Thank you very much, Gary. 80% of in-home care for people with chronic health conditions or intense medical care needs is carried out by an unpaid family member or friend. It's a heavy burden, and that's just one reason why CICOA says it's taking a more active role in research. President and Chief Executive Officer Tauhric Brown says participating in studies will help CICOA understand the challenges its consumers and their caregivers are facing and fine-tune how to best carry out its mission. He joins me now to tell us more. Hi, Tauhric. Thanks for being on the show today.
Great to be with you, KYLIE.
All right, let's start with a quick introduction, just a thumbnail of what CICOA does and some of the services that you provide.
Absolutely. So what CICOA does is we connect older adults and people with disabilities to resources in the community and services that they need through our Aging and Disability Resource Center. Many of those phone calls end up being services that we're providing to them, such as nutritious meals through home delivered meals, case management, home repairs and modifications, transportation, caregiver supports, and much more.
Okay, so you're taking a much more active research line here with CICOA. You've already partnered with Stanford University, IU Health, Eskenazi Health. Why is research such an important part of your mission now, especially, looking forward?
Yeah, I mean, many of these, those are really opportunities for us, KYLIE, to understand business intelligence, right? To grab that data, mine it out, and leverage that business intelligence to help us address unmet needs and or gaps in services that exist for the populations that we serve.
And one thing that your research has already uncovered is the importance of caregivers. You recently participated in some studies on caregivers. So can you tell us what some of that research is finding about caregivers in particular?
Absolutely. So the first thing to mention is caregiving is obviously on the rise. We know that we are in an aging, our aging population here in Indiana is growing at a very rapid rate. And so the need for family caregivers or caregivers in general will continue to increase. But in addition to that, we also know that 4 out of 10 of those caregivers currently have reported that they are just continuing to be stressed out and at their limits as it relates to the family member that they are providing that care for. And so that's really what sparked us to get more involved in the caregiver support realm, to be a resource for them as well, to help minimize that stress that we know they deal with on a day-to-day basis.
So can you tell us about some of the things that CICOA is doing to try to give those caregivers more support?
I absolutely would love to. So there are 2 examples that I'll mention here with you today. The first is a dementia grant that we have through the Administration on Community Living. And it's CICOA, a few other area agencies on aging, as well as IU and Division of Aging here in the state of Indiana. And this is really looking for those individuals who are Medicaid waiver participants with an Alzheimer's or dementia-related diagnosis, working to help strengthen their caregivers that they've got. And it starts with an assessment that kind of identifies a baseline of where that caregiver's stress level is. Is it low, moderate, or high? And based on that score, we'll then provide different resources, respite care for that particular caregiver, support groups, things of that nature to really help bring that stress level down to something that's a little more manageable. The second thing that we've done is last December, we began utilizing an assessment for caregivers through our CareAware department, which is our caregiver support arm of CICOA. And TCare is an assessment as well that's done for family caregivers to do the same kind of thing. to tease out and determine where that stress level is currently, and then to be able to provide some great resources and some solutions to that caregiver to help reduce the stress that they are feeling and dealing with every day.
All right, sounds like two great programs. One thing we also need to mention is that you are the new CEO of CICOA and also the first African American CEO. How does that help shape how you lead CICOA?
Yeah, I think that's a great question, KYLIE, and thank you for that. You know, I think it helps shape how I lead CICOA. I hope that it demonstrates outwardly that our board of directors in this organization is very committed to having a great lens on diversity, equity, and inclusion that allows us and allows all people in our service area to know they have a resource here at CICOA that can help strengthen their quality and quantity of life and hopefully improve the independent living that they have enjoyed through their aging years.
All right, and Tauhric, just a few seconds left. I mean, caregiving was hard before COVID, even harder during the pandemic. These caregivers are facing even new challenges, right?
Yes, they are. The stressors of caregiving is really exacerbated, right? Through COVID, each individual, and I think about a few of my friends who are family caregivers of their mom or dad, and through COVID, they lost jobs. Children were not in school. And so you can imagine that they're dealing with the stress of just caregiving and as a whole, but also you've got those other stressors that they're dealing with as well. So it really has been exacerbated. And so, for caregivers, we obviously want them to know we're here as a resource as well. We do a lot of friendly visiting calls or friendly telephone calls to our clients. Hopefully caregivers as well could be part of that, just to let them know there are resources available to help them with this incredible lift that they have on them each and every day.
All right, Tauhric, some really good points. Thanks for being on the show today and telling us about it.
Thank you so much.
Gary, back